So, you cannot deliver healthcare through a market because markets create winners and losers. That's the bottom line.
Facto, het manifesta. Allyson Pollock en Sophie Merks.
Welcome, Allyson. It's very nice to have you here. Allyson, you're a doctor and a professor about public health, but in 2020 you got a prize, and the prize was Speaking Truth to Power. And also when I was researching a little bit about who is Allyson Pollock, when we go on the internet, we see that you're a professor, but you're also very much like an activist or a campaigner for public health. So how do you become passionate about public health?
Oh, that's a very good question. Well, first, thank you for inviting me. It's really wonderful to be here at this important festival. But I started off as a medical doctor and then I did another 5 years of training in public health. And I think the reason why I went into public health was because I was shocked by the huge inequalities. Even in the UK, where we have a National Health Service, the differences between rich and poor and the different areas. And then I became even more shocked by the actions of our government, seeing the way in which they were concealing from the public, the way they were reducing services and closing beds, closing services, even back when I was training in the 80s. So that made us mobilize, and I was a co-founder with others of Keep Our NHS Public, and it really started from there.
It's true that I think when we talk about public health, it can sound like something who's about statistics, but as I say, I remember that when I was a young doctor and I was just having my consultations for some months, and there was this man coming in and he said to me he was having pain here, and I said to him, you have to go to the hospital. And the man said to me, no, I won't go, I don't have money to pay the hospital. And every time when I'm struggling or fighting for healthcare, free and universal healthcare, I think it is really coming up, and I think about all these people for who it's so important to have this free and universal healthcare. So I want to ask you another question, Allyson. Last year we saw the strike and I've been told that it was for the first time that nurses went on strike in the UK, and we saw the doctors and the nurses with these pancards, and there was written, "Save our NHS, the National Health Service." But you have to know that in Belgium, it is not really has a good reputation. We heard about waiting lists, we hear about state healthcare, but how is it possible that doctors and nurses are struggling to save the NHS? Can you explain it to us?
Yes, so there are two things that are going on. One is the staff that work, the nurses, doctors, pharmacists, the people that work in the NHS have been constantly squeezed because the effect of using public-private partnerships and privatization is to take money out of the system and give it to shareholders and bankers. And that means there's less money in the system. So what happens is that puts a pressure on the nurses' wages, the doctors' wages, and also the number of staff and the training of the staff. And so the quality is affected. Now the staff understand that. They understand you can't deliver high quality care if you don't have enough staff, if they're not properly trained, and if they're overworked and not paid, if they're worrying about how they put food on the table. So the staff understand the connection between their terms and conditions and providing good high quality care to patients, which is why they have linked Save Our NHS to the strike, how important it is. So really it's a two-pronged strategy, one for wages and terms and conditions, and the other to defend and protect the system and build it up. Yeah.
And so you've been studying public health for 30 years. So can you tell to us, or to someone who's listening to us, why it is so important that health is organized publicly and not privately, like we can see in the United States? What is the difference for the people, the patients, and what is the difference for the staff who is struggling for it?
So you cannot deliver healthcare through a market, because markets create winners and losers. That's the bottom line. And you know it when you do your own shopping. Some people can afford really nice cars, other people can't. So that's the market system. I spent a year in the United States in 1996, and it was shocking to me to see how people were terrified of illness or losing their employment, because employment was linked to their health care. And it made me realize that the NHS had created, the government in 1948, when the NHS came into being, created something very beautiful. It gave the public freedom from fear. It's really horrible if you have an illness or your family have an illness, but it's so much worse if you're worrying about how you're going to pay for the medicines, how you're going to pay for the care and all the care. So Bevan said, we're giving the people freedom from fear. It's not free health service because everybody pays for it collectively and solidaristically, and we do that through taxation. So we separate the patient and the doctor from the money. That's really important, so there are no conflicts of interest. If the doctor thinks he's getting paid by the patient, he or she may be tempted to overtreat, overdiagnose, overcharge, or if the patient can't afford, they'll undertreat and underdiagnose. So if you take the money out of the equation, then you're on a much more equal basis, and you're making a decision without the financial constraints coming in. And that's so important in healthcare, to give freedom from fear. And also you do something else. You create a solidarity, a collective feeling, which is why people in Britain still love what the NHS stands for. They still believe in the principles of free at the point of delivery, there for everybody, and public ownership and public provision. But they're increasingly dissatisfied because they know now the system is being broken up and it isn't working. But they still believe in the principles. It's our politicians that no longer believe in the NHS, not the public.
Yeah, because we saw also that because even if it is going bad with NHS, it's still quite popular. Popular by the nurses who are working there and the doctors, and also popular by the people. And I think it's what you said about it. It's so important for people to even if you're sick, you know that you will be taken care of and you don't have to worry about paying. And it's also what we're experiencing, for example, where we work in medicine for the people, who people can come to the doctor and they don't have to pay. It is really, they are reassured, and they can come as many times as they want, and we are not paid in these primary care centers if we see the people a lot of not, and there is not this relation, this commercial relation. But in general, also in Belgium, of course, the system is really liberal, and that's just what's happening also in the hospitals. There's really this commercial logics coming in, profit logics coming in, and so the hospital is paying more and more if they do more consultations, more operations, more. And we see that if you have, for example, these diseases who can be profitable, for example, hip surgery, you can be helped fast. But if you have a complex pathology, you're an old person,
yes.
You're in geriatrics,
yes.
Nobody's listening to you, because listening and taking time, nobody can make some money out of it. So
absolutely right. Because markets, as we say, create winners and losers, but the market picks and chooses. So they like to pick the profitable patients, the profitable treatments, and then the complex elderly or children with disabilities, the market is not interested in, which is why it's so important to build an integrated system without fragmenting it, where the private sector likes to pick and choose, so it breaks up the services and it takes little pieces. And so that's why it's so very important not to have a market.
Yeah. So maybe you can still explain us now, so in 1948, when the NHS was founded, what meant it for the people, and what was the vision about it, very concretely? When you were sick, what was happening?
Yes, so basically it was very interesting because during the war the government created an emergency hospital service so that the men and women who were killed in fighting or when the bombs were hitting could come to hospital and not worry about bills. And so they said, well, we'll open this up to the people. So for the first time, all the people had access to hospital care. And of course, after the war, the system was broken. The country was completely, it had no money at all. So the only way forward was to build it solidaristically. So the government nationalized all its hospitals, all its medical centres, not all the GP surgeries, but the primary care, but all its mental hospitals, community services, and also most of the staff were all salaried as well on national terms. So that gave incredible reassurance for the first time. There would be national pay bargaining, national terms and conditions. But for patients, it meant for the first time they didn't have to worry when they felt sick about who was going to pay for the medicines, who was going to pay for the treatment, did they have to go without care? And one only needs to look at America to see how shocking it is when you don't have a universal healthcare system, where 60 million people go without care because they have no insurance or they're underinsured, or they bankrupt themselves. You know, people would so now, you know, this is what the NHS meant. It meant as a patient, I didn't have to worry. And so to begin with, the government thought we'll have, infinite demand, you know, the patients will be lining up and we'll never get to the bottom of it. And so, of course, to begin with, people were lining up for spectacles, glasses, and hearing aids and their dentistry. But after a while, it plateaued because it isn't infinite demand. You know, its need isn't infinite. Once you meet that, you get to a steady level, and so it proved. And the other thing about the NHS was it was incredibly inexpensive. It was really cheap. It ran at 3% of gross domestic product because the Treasury, the finance department, wasn't very approving of the NHS, so it screwed the money down. So the NHS had spent almost nothing on administration, and it spent most of the money on staff and services, and it was really inexpensive to run, and that was a really, really important. So actually, it was another lie, the myth of infinite demand and escalating expenditure.
And was it also, in NHS in the past, was it also about prevention? Can you tell me about
Yes, prevention was always criticised for not doing enough prevention, but prevention was built into the National Health Service, occupational health. It was really important, and actually the NHS did a lot of important work on health promotion, health prevention. It had departments and teams of people working on that. So I think it's really, it was meant to be comprehensive and universal. But then over time, it was the politicians that chipped away at it. They took out long-term care, and then they took out dentistry, and then they took out prescription medicines, and they put charges in, you know. So over time, it's been gradually whittled away, reduced and reduced. But the overall vision is still a really important one. But that brings me to another point. It's not enough to say we have these wonderful principles of free at the point of delivery. You have to design the system really carefully so it covers everybody and gives everybody freedom from care. And that means you have to create a very complex, sometimes, technocracy, a technical apparatus that is able to monitor the population, measure needs, do some planning, and make sure the services are there where the patients most need them. So when I was doing my public health, we knew, diabetes was an issue, and also mental health services and women's services, and we would think very carefully about where the needs were and where the planning had to be, and we put that in. So that's the other thing about a market, is there is no planning on the basis of need, and we should stop using the word demand. It's about medical need. And so you build a careful technocracy that is able to do the planning and be very sensitive at local level, with really strong accountability at the local level as well as at parliamentary level. So you respond to local people locally in your community, and if that's not working, then the politicians you go up to the parliamentary level, but you have different layers of accountability.
So that is what the philosophy was and how it's worked, but you already talked a little bit about it, but then in the 80s, the 90s, and these years on, I think NHS is facing a crisis, is facing a privatization. So can you talk a little bit about it?
So after Mrs. Thatcher came, and many people listening will be too young to remember Mrs. Thatcher, a big conservative government in the 1980s.
I still know.
But basically, she carefully started the process of dismantling our public services. So it wasn't just health, it was all the other 5 pillars, social security, education, but this was an incremental process. It's been a slow process over 30 years with an ideological basis. So the ideology was now, market is good, privatization is good, public is bad. And that has been the ideology. But to put that into practice, they had to dismantle the NHS, which meant changing all the laws that governed our NHS. It meant constantly restructuring and changing to move it towards a much more American-type model, so that increasingly people would now have to think, the market could pick and choose, the market could enter, it could decide what services, who it would treat, where it would treat people, not the people deciding where they'd be treated or how they'd be treated or what services, but now the market, these big corporations decide. So they close down hospitals here, they close down services there, and they're moving in really quickly. And I will say one thing, the UK NHS was a model maker for the world in 1948 in how to have a universal public health system. The Americans knew if they could break open the NHS, the unopened oyster, they could then break into all the other European systems, because other European countries have more private elements in them. So by breaking open the NHS, by people thinking, oh, it's not working anymore. Well, the reason why it's not working is because it's being dismantled and privatized. But people don't necessarily understand that. All the structures and systems that protected it as a public service free at the point of use are being dismantled to allow the penetration by large companies like Hospital Corporation of America, United Healthcare, big insurers. They're all moving in and grabbing bits of service and a lot of the money, and it's having a huge effect on staff, because the staff are also having to move across to work in these private companies. So we have a real blurring of what is public and what is private.
Mm-hmm. So now there are 2 systems existing, public and private in England.
Well, there have always been 2 systems. We've always had a small private system for people who had money that could pay. But now what's happening is the NHS, instead of providing the care directly, is contracting out, outsourcing eyes, hips, knees, diagnostics, radiology, pathology to big companies. It's giving the companies the contracts. The companies then are employing the staff that once worked for the NHS, and it's marketing to recruit the patients. So that means that the money for the NHS is decreasing, for the direct in-house provision is decreasing, and the service is disintegrating. So it's a blurring of public and private funding and public and private provision, because these companies and the NHS can also offer private health care. So since 2012, public hospitals can now earn up to half of all their annual income privately, so from private patients. So the public hospitals can make some of the wards, half the wards if they want, or half the beds, private for private patients, and bring in private money.
Yes, that we also see this system in Belgium. Of course, it is different, but for example, we have these one-person surgery rooms where doctors can ask more money, and so they're developing these private rooms where people have to pay a huge amount. You have to have a private insurance to pay this, but they're developing this, and on the same time, for the normal patients, they have to wait longer, or they're not taking care on the same quality. And we also have these two medicines,
yes.
two ways.
Yes.
One is fast and the other is
absolutely
slower.
So the people on the waiting lists either have to go without care or wait a long time if they can't afford it. And it creates huge inequities. So what we know for people for eye surgery, cataracts, for their hips, surgery and knees, over half of that is now being done in the private sector, but paid for by the public purse. So these big companies are doing it. But the social inequalities are huge. They're rising year by year, so they're growing. Because the private sector likes rich patients because they tend to be healthier and younger or healthier. It doesn't like poor patients. And also, private patients can pay top-ups. They can pay a bit of extra money. So that is why you're seeing the inequalities are rising. So the more complex patients tend to be the poorer patients who tend to be sicker, and they get left behind. So that is creating huge inequalities within our National Health Service.
But if I understand what you said a little earlier, is that the privatization makes it more expensive for also the state in some sort, and before it was cheaper. Can you explain this?
So when you have a purely public system, you don't need to do billing and invoicing and commercial contracting, nor do you need to do marketing. I don't need to sell you a hip. You know when you need a hip replacement, you come to me. I don't need to say I'm advertising. And we know from the US up to 40 to 50% of the budget is spent on what they call transaction costs, the administration of the market, billing, invoicing, contracting. So all that money is lost from the system. As well as that, the private sector has to make profits, and it has to give you a large salary plus bonuses, maybe £1 million. It has to give you a lot of money. So more money leaks out and leaks out of the system. So it becomes incredibly expensive, which is why the US, which costs 18% of the GDP compared to the European average of 10 or 11%, it's escalating. That's why the US is so expensive, and yet it denies 50, 60 million people access to health care.
So if I understand, if we do it private, it's more expensive, but it is also the public health indicators are not better.
No.
Or can you explain this?
So it's more expensive. It increases inequalities because the market picks and chooses the richer patients. And if you leave the poorer patients who need care on the waiting lists, they either die or they get sicker and sicker and their quality of life deteriorates. But also, the private sector is what's called quality shaving, because it takes so much money out of the system, there's less to pay for nurses, for doctors, for medicines, for the clinical care that patients need, and they're pushing patients out of the beds faster and faster. The nurses are no longer trained. I have so many trained nurses, they replace them with physician assistants or nursing assistants who are important, but you also need the other senior expertise. So what happens is quality of care drops. Now we know from the US that where there are for-profit corporations, or even not-for-profits, because they behave the same way over time as the for-profits, then the quality of care drops dramatically because of all these factors. And I think that's a really important lesson, because when your doctor knows you and the family, you get continuity of care. That's really important, that you know your patient, their needs, and they come back time and time again. In the American system, the first thing they do after they've taken your Visa card or your credit card is they over-test. They order far too many tests and far too many diagnoses. So we know in Florida, some of the big companies have been in trouble because they've given people heart operations for conditions they didn't have. And I can remember in Phoenix, one doctor saying, it's your job to find the operation the patient needs, you know? So it's really important to remember the ideology of the market and privatization drives very bad behavior and huge conflicts of interest for the doctors and the nurses when they're working in the system. And that's why it's important you take these conflicts of interests out, so you're responding to need. So no system is ever perfect. You're trying to improve it. But if you're starting with a flawed system, a completely bankrupt system based on a market and privatization and that ideology, you're never going to get it right.
Mm-hmm. Yes. Allyson, maybe a question also is, you talked about NHS, about past, about how it was, but this public health vision, why is it a vision for the future?
Yes, we must hold on to that vision. So the NHS I've been talking, UK is no longer one UK NHS. I have been talking about the English system, which covers about 70 million people. But Scotland still has a much more public system, as does Wales. So it's important to remember, because health has devolved in the UK. So it's really important we don't lose the institutional memory, because the architects of the NHS felt really passionately, and they paid really careful attention to the design of the system. And we need to do the same. It's not enough to have the vision, which is important, or the principles, but together we need to rebuild the system. So we take out the commercial conflicts, we take out the market transactions, we make it more accountable to our patients, to our local communities, and to Parliament. But that means we have to pay careful attention to the design of the system and to make sure that we can respond to needs and plan services for the future. All this is possible. It takes political will, and it's wonderful to talk to you as a doctor and a politician, because you have the political will and the insight. So perhaps you'll be the next Aneurin Bevan for Belgium. It would be wonderful. Yeah. So Aneurin Bevan was the creator of our NHS. So you know, it's everything is possible. It takes political will, but it also takes people power, which is why Manifesta is so important, because you have to build community knowledge, community education, have discussions so they understand why the system's failing, where it's failing. It's not just about more money, it's about getting the design right and taking out all those commercial conflicts that really make the system rotten. It becomes the commercial sector is parasitic. They are parasites. They want to extract as much money from the system, and they don't really care about the public or the public health.
I think also the commercialization of the sector and the fact that it's almost also in Belgium, it's a lot about money, 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 and we also see that the nurses and the doctors who are working there, they lose sense, because when you do this job, when you become a nurse, you do it to spend time, to talk with this person, to really care. and you don't do it to make money. And I think it's also a reason why a lot of people now are having, there are a lot of people in the hospitals also who are sick, because they're becoming sick of the system and they're going away. And that's also why we don't find nurses to work in the system, because the system is sick.
That's absolutely right. In the United Kingdom, in the social care, long-term care sector, we have 100,000 vacancies. So we need 100,000 people to fill the vacancies that we have. It's really shocking, 12%, you know. We have too few staff. And that is because we don't pay people enough. Many are women, they're low paid, and it's very hard work, and so therefore they turn away. And then on the other side, you have some doctors and some nurses that see an opportunity, so they create companies, and they begin to create their own companies and take the business away and behave like small businesses, and then over time these companies get bought out for millions of euros and they make a lot of money. So on the one hand, the majority of staff get disillusioned and tired and very stressed, and we need to bring those staff back in, and we need to pay them properly and recognize how important. We have to care for the workers. They care for us, so we have to care for them.
Yes.
And you do that through giving good terms and conditions and wages.
Yes. Allyson, we're already going to the end of our discussion, but I think it is really important in the UK, but also in Belgium, healthcare is facing a crisis. Like as you said, we need money, of course. We cannot agree. We had a lot of governments who took money away from public health, and that is not all right. We have to have more money for it, but we don't only need more money. We also need, I think, another vision, another way of seeing to health, seeing to the health system, really having a healthcare system who is global, from prevention to the moment when the sickness is there, and to health care. And I think NHS was a little bit like that over time, and today it is facing real trouble. But I think it's important to give hope to the people also, that we really struggle also to have another vision of healthcare.
Yes.
Because profit and health don't go together.
So we have to stop the Americanization of healthcare. We need to get the vision into practice, which means rebuilding capacity, public ownership, public control, public provision, and salaried workers, and public funding. And when you do that, all these elements come together and you create something very beautiful.
That's a whole big program. It's lot
possible.
To do.
It was done in 1948 when the countries had no money and other countries followed suit. Everything is possible.
Yes, I also think that is really the message. It is possible that healthcare is human, that it is social, that it is free for charge for patients. Maybe we can finish on this positive
very
words.
positive note. Yeah, thank you very much for inviting me.
Thank you.
Thank you.